Turning to another public health issue, has the mission to get guns out of the hands of the mentally ill gone too far? The New York Times reported that more than 34,000 people have been added to a list of New Yorkers deemed too dangerous to handle a firearm. The list was created in the wake of the Newtown massacre, but now some in the mental health industry are pushing back, saying too many people are on the list, raising the question, where do we draw the line? And who does the drawing? Dr. Richard Alan Friedman is a professor of clinical psychiatry. He is also the director of psychopharmacology at the Weill Cornell Medical College in New York. Dr. Friedman, thanks for being here.
Thanks for having me.
So first, let's define the terms of this list. How has New York gone about picking who is on the list?
Right. So the way the state designed the law basically was to tell mental health professionals that if they are concerned that somebody is at risk of hurting themselves or hurting somebody else, then they belong on this list of people who are potentially dangerous to self or others and should not be able to get a firearm.
So more than 34,000 people, as we mentioned, are on this list. You're against the list. Why?
Well, I think it's a well-intentioned law with ill-intended, undesirable consequences, meaning because patients, psychiatric patients, know that when they talk to their psychiatrist or mental health professional, that they're likely to be reported if they reveal that they're thinking about hurting themselves or hurting somebody else. It might discourage patients from being frank or honest with clinicians. And it might even discourage people from seeking help in the first place. Now, that's not a result that people want.
Yeah, but you know, you think about the groups that we hear after Columbine or the Santa Barbara shooting or the Newtown massacre, and they say we've got to fix the mental health system in order to deal with this problem. Is that the answer? Is the system so broken, and if we fix it, does it solve this issue?
The answer is the system needs to be fixed, but fixing the system will not fix the problem of violence, because if you look at it, 96% of violence in this country is perpetrated by people who don't have a mental illness. The mentally ill really only account for about 6%.
But do they account for the most violent instances of crime?
No. They account 0.1% for the mass killings, which are actually the most spectacular and horrifying of all, homicide. But they get a lot of media attention. So the mentally ill really account for a very, very, very small proportion of violence in this country.
So what's the state to do? Because it's sort of like they're damned if they do, they're damned if they don't. If they don't, and if an incident happens, people are going to look at them and say, look, you had this information right under your nose to protect the public and you chose not to use it. And if they do use it, you've got civil liberties groups and others coming out saying you're unfairly targeting this particular group of people. What's the state to do?
The problem, I think, largely is not a medical or science problem, it's a political problem. So when you say, what is the country to do, or what is the state to do, it's very hard to control human behavior and very expensive to do it. It's probably a lot easier, not politically, but it's probably a lot easier to limit the expression of human behavior by having sensible gun control.
This number, 34,500 on the New York list, it has a lot of people saying that's a giant number, that doesn't seem right, that's too many, but I did a little math. Based on the population of New York, which is 19.65 million, 34,500 is only 0.175% of the New York population. When you look at it in those terms, it doesn't seem that out of whack.
No, I mean, it's a tiny fraction of the overall population, but if you were to ask the question, what fraction of those people who are on that list are actually a danger, it's probably very, very small. And I think the reason is the law has many clinicians worried, and so they're practicing defensive medicine. Nobody wants to be said after the fact that they missed a potentially dangerous person. And since mental health professionals are really bad at predicting violence, I mean, no better than the toss of a coin, what it does is it encourages clinicians to over-report. So the system is going to be flooded with false positives.
Hang on, back up there. Mental health clinicians are no better at predicting violence in their patients than the toss of a coin.
Correct.
How is that possible?
Because although we know a lot about the epidemiology of violence, meaning we can tell you the risk factors that are associated with the violence, even if you get somebody who has all those risk factors, and I can tell you what they are, most of those people who have those risk factors will not turn out to be violent. And they are being young, being male, using drugs and alcohol, and having a serious mental disorder and a history of violence. those are the biggest epidemiologic risk factors. And if you go out and you find those people and they have those risk factors, most of them will not turn out to be violent.
Okay, so the watch list in New York came about because of the SAFE Act after Newtown. Other
Yes.
states have done similar things. Is there any state or municipality that's doing something along these lines that you think is working?
It's hard to know because it's like looking for a needle in a haystack. You know, these violent acts are rare events, and so to find out whether an actual measure works, you need a lot of time to go by. So the answer is nobody really knows.
And how do you see it playing out in the next few years?
I think sadly what's going to happen is we're going to have more of these mass killings because the real problem is the easy access to firearms. We're never going to be able to really identify who's most at risk of committing violence. It's just the state of the science.
So unless a person has been involuntarily hospitalized or they're in a mental institution, there's probably no way of preventing a mentally ill person from buying a gun. So there has to be some sort of mechanism earlier on that helps these risk factors appear. What is that mechanism? Is that in the schools? Where does that come in?
That's a critically important question. And I think, you know, we need to do a better job as a society educating the public about what those risk factors might be. So for example, when you're talking about young people, you know, when you see a young person who's suddenly very interested in violence, who spends a lot of time on the internet, who's socially isolated, or who's bullied and tortured at school, who suddenly starts acting in a way which is not characteristic, everybody ought to worry. His friends at school should worry, his teacher should worry. We should probably be encouraging a culture where people pay attention to these things.
But the logical follow-up from everybody being worried and teachers paying attention is somebody reporting it.
Correct.
Are they in any better position to be accurate about what they're reporting than these clinical psychologists and psychiatrists in terms of the patients that they're reporting now?
Statistically, no. But because most of the people who commit, let's say, mass killing, which is a very, 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 very small fraction of overall violence in the country, but since most of those people have severe mental illness, they tend to shun the mental health system. So mental health practitioners never see them. So basically, these are people who are at large in the public who avoid the mental health profession. That's why we will never see them.
Dr. Richard Friedman, thank you so much.
My pleasure.
And